Now, there's just 2 weeks to go before medical interns, are supposed to take up community service posts. However, the health department has not yet begun accepting applications. The aspirant doctors are now in limbo, as this will delay them qualifying as doctors. It also leaves clinics and hospitals under-resourced. Let's get some reaction to this from the South African Medical Association's Dr. Akhtar Hussain. Dr. Hussain, thank you so much for your time and good morning to you. The impact of this delay, particularly on community doctors and interns, what does it look like?
Good morning to the listener of eNCA. Yes, the issue of non-placing interns and community service every year is becoming a disaster. Even last year, they delayed placement. And this year, for 1st of July, interns and community service doctors supposed to be placed from 1st of July. Now, it's only 10 days left, and they are not placed because their system is not working, IT system is failing, ICSP, that is the system they use, is not working. So the impact is the intern and com service will be starting delayed. Now maybe when they will start, we don't know. And they are sitting at home without working, losing every day their experience, their knowledge, and they're supposed to go and serve the community, and which is not happening. Even then, they are having bursary holder, some of the students have a bank loan, they have to pay the rental, they have to look after their family, children, schooling. So this is a ripple effect, not only the doctors' work, also the family and the economy effect will be there.
But also my understanding, Doc, it means that this delay will have an impact on the hundreds of students' qualification as doctors. So it means that they will have to wait a bit longer before they receive that qualification stamp.
That is true, because at the moment, 160 interns and more than 200 community service doctors are waiting to get the placement. And every year, 2,000 to 2,500 intern and community service qualifying from South African Medical University, and they are South African citizens, and it is a mandatory to Department of Health to place them for internship training. Without doing internship training, you cannot go and work private or independent practice. And on that, they have to do 1 year community service, which is they have to run the clinic, rural health services, and there are no other doctors. There's a huge shortage of doctors in countrywide. Even the minister himself in the parliament accepted that there's a huge shortage of critical healthcare services. But where there's 100 doctors are sitting at home, they are not employing. There are no job advertising anywhere. So our junior can't even apply to go and work. And if you don't do that internship, which is mandatory, and the government knows when you're giving admission in first year medical school, there are 5 year or 6 year time they will be qualifying as a doctor. So why they didn't, the planning is a poor planning, no implementation, and the blaming of budget, no funding. And when we asked for funding, they said Treasury, and Treasury said there are no moratorium on doctors' funding. They must continue, because when you give a first-year admission, finally they know how many doctors will qualify. Why they didn't budget in time? And there are no communication at the moment with the department, not telling individual intern what's going on. We as a stakeholder, South African Medical Association, we have been helping Department of Health placing, because we have got all the expertise how to run the intern services. We are the one give them training. This 2-year training is mandatory, and now they're going to delay it. They will be disadvantaged in future, because the other people are also completing this internship, and they are going to apply before those who are not getting placed.
Well, of course, that is a concern, especially when you made that example of rural areas currently experiencing a shortage in staff, Doc. I just wonder the knock-on effects this will have on many hospitals and clinics around the country that do need the expertise of these hundreds of doctors that are yet to qualify. We'll have to leave it there, but I appreciate you speaking to me. It's the Medical Association's Dr. Akhtar Hussain. Thank you for your time this morning.